We talk about cancer spreading. We know that's the horse out of the barn. That's a bad stage. But does it have to go? Does it have to go from one organ where the cancer initiates to the lymph nodes to another organ, or could it skip the lymph nodes?
Yes, it can skip. There's different ways that cancer spreads if it's not successfully treated. So cancer usually starts in one particular site or organ, and that can be anywhere from your finger to your eye to your lung to your wherever. And either can spread locally, so it keeps on growing locally, it just pushes aside everything else. That's one way of spreading. Another way of spreading is through the lymph system. Now, you know that the body is mainly water, and this water and fluid has to have a way of circulating. So not all the fluid circulates through the blood vessels, but there's a parallel system called the lymph system, and the stations along the way are called lymph nodes. So sometimes the cancer cells get into the lymph system, and then the lymph nodes are like little nets that kind of collect cells. So sometimes cancer cells will grow there. So that's the second way. And then the third way, which you alluded to, is the cancer can get into the bloodstream directly and spread. And once it's in the bloodstream, it's like being on a highway. It's like a terrorist being on I-95. He can end up anywhere. And that's true. Once it's in the bloodstream, it can end up anywhere from brain to liver to lung to adrenal, etc.
Right. Okay. Also, we know a couple of weeks ago a Hall of Fame baseball player died. We've heard all kinds of terms for mouth cancer, cancer there. Now, I'm under the impression this guy was using chewing tobacco. He's putting it in his cheek. Now, in your mouth is saliva. People don't realize what saliva does. I'm pretty sure saliva breaks down whatever you put in your mouth. So if it's something bad, it's breaking it down, and his body is absorbing it. Is that basically what happened to him?
Well, I don't know anything about his case. I mean, there's different reasons for head and neck cancer. So all the cancers of the sinuses, mouth, oral pharynx, respiratory system, all that area is called head and neck cancers. And what are the risk factors for head and neck cancer? One, as you say, is tobacco. There's chewing tobacco, and there's smoking tobacco. And, yeah, you see the baseball players chewing tobacco, but that doesn't mean they don't smoke. And there's probably a lot that do smoke, unfortunately. So that's one issue. Another issue, there's an epidemic right now in America, and that is from human papilloma virus-caused head and neck cancers, especially in men. It's thought to be due to oral sex, that men get human papilloma virus from their sexual partners. And if you remember, Michael Douglas last year said that he got this cancer of the mouth from oral sex, human papilloma virus. I think that led to his almost divorce or divorce from Catherine Zeta-Jones. So there's different risk factors. It's not only smoking tobacco. And there's some people who don't do anything. They live a pure, normal life, no smoking, no drinking, no sex, no nothing, and they can get cancer too. So nothing is always or never in medicine.
Right. There's anything is possible. That's the bottom line. Right. And to me, this show is just a fascinating show. It's just like going to school, Doc. I love listening when I get a chance.
Thank you very much. God bless you. And if you want our booklet or DVD, we're happy to send it to you. Just give us a call during the week at that 212 Choices number, and we'll be happy to send you the booklet. And we're actually making a DVD with many of the shows, so you can listen to them again if you want to. All right, thank you. Any other callers, please feel free to call us. We're live in the WOR studios. We're happy to take your call. We had a gentleman come in this week who had a Gleason 8 prostate cancer. He unfortunately had radiation elsewhere. He was given the dose, which would be considered suboptimal, and it's very hard for patients to know exactly what dose you should have. I mean, if you go to a grocery store and buy a pound of flour, you know that it's a pound of flour, but what happens when they give you 14 ounces? Well, you know that happens sometimes. Well, in radiation too, sometimes they give a lower dose. Now why? Well, maybe they were trained to do that years ago. Maybe they are worried about being able to safely give a more effective dose. But for this patient who had a Gleason 8 cancer, and again, you can look at our booklet, page 11, figure 17, from two big hospitals, Ivy League hospitals, for Gleason 8, 9, 10 cancer, the success rate with standard radiation was 0%, compared to us 70%. So it really does make a difference where you get your treatment. If you knew in advance that you're going to have a 0% success rate, you probably wouldn't do it. And probably no one ever told this man that the data exists. We give the data to every person, the patient, the family, every person. Why? Because we believe the patient should be educated, and we believe the patient should know in advance. And we're proud of our data. Why wouldn't we be proud of our data when we're beating the pants off of everybody else? But we're not doing it just by words. We're doing it by facts, and the data is there. So please, if you have a cancer, and that's what we do, we're a cancer treatment center located in the heart of Manhattan, and we take most insurances, Medicare, Medicaid. So we try to make it convenient, we try to make it comfortable, we try to make it financially possible for you to get care with what we consider a superb center, and it's outpatient, so you don't have the risks of super infections. You don't have the higher prices of hospitals and other facilities. You don't have the confusion of being lost in a hospital with a million doors and a million strange faces. Think about Radiosurgery New York and see what a different style of care will make to you. We have a person from New Jersey, so I want to take that call. So good morning, New Jersey.
Good morning, Dr. Lederman. This is Jerry. A long time no hear.
Hi, Jerry. How are you?
Oh, I'm fine. Thank you very much. We're spending the summer at the Jersey Shore. I do have a question.
Okay.
I know that several weeks ago you were bringing us up to speed about CyberKnife. I believe there's some problems with that. And the question is, we have a neighbor, and he's not a caregiver, but he's going to be helping a lady going to a hospital in Long Island, I believe, that does CyberKnife.
Uh-huh.
And the woman apparently, now this is through the grapevine, and I can't mention this because I'm a third party. But at any rate, she seems to have a neuroma. Mm-hmm. And I'd like you to bring us up to speed on the possible problems with CyberKnife.
Well, first of all, let's talk about neuromas. So the most typical neuroma in the brain is the acoustic neuroma, the eighth. Excuse me, just hold on 1 minute. I just going to take this call. Who's calling in for the radio? Hi, just hold on 1 minute, and we'll get to you. Just hold on. Acoustic neuromas are benign tumors of the eighth cranial nerve. They're tumors that usually in the past were treated with surgery, and the problem with surgery was that most people would end up deaf from the surgery, and a substantial share of patients would have facial paralysis from the surgery because the eighth nerve where the schwannoma occurs and the facial nerve, seventh nerve, are just next to each other. And when the surgeon goes in to remove the tumor, they cut the hearing nerve, bye-bye hearing, and seventh nerve, bye-bye face. So we pioneered fractionated stereotactic radiosurgery 20 years ago, and we actually have the largest experience worldwide for treating acoustic neuromas or schwannomas with a success rate of 97%. What are the problems with CyberKnife? Well, there's lots of problems with CyberKnife. Number one, there's lots of radiation exposure to the patient's brain, number one. Number two, we give the lowest biologic dose. And dose matters. When you give higher doses, and unfortunately we've seen lots of complications with CyberKnife, where the higher doses leads to higher complication rates. This is a tumor, a benign tumor, it's not a cancer, that is very, very sensitive to focused beam radiation. And that's really why we do what we do. We were the pioneers in this. We took a lot of abuse from surgeons who didn't believe radiosurgery would work. Well, actually, we have data out 20 years that not only does it work, but it's well tolerated with good quality of life, good facial function. We almost never see damage to the face. The vast majority, more than 96%, keep hearing, and 80% keep hearing at the normal rates. So, yeah, we'd, of course, love to tell our story to this woman, but not everyone knows about all the options.
Thank you very much for your help. I thank you also for the package you sent recently. And I've been busy in the suburbs, and people have been coming to me recently. And this is another one that has an acoustic neuroma. The other people were prostate cancer, and another one was a diverse problem. And I just suggested that people would call your office. But I've been busy being an advocate, believe it or not.
Well, thank you. We're just at the end of the hour. Maybe you can call back tonight. We have another show tonight from 9 to 10 and tell others about what's happened to you and why you're such a strong advocate. So God bless you and your wife, and I look forward to hearing from you and seeing you soon. Thank you. I know there's been many callers who just tried to get through to me. If you have questions during the day, call at 212-CHOICES, which is 212-246-4237, 212-246-4237. If you want that booklet DVD, call us. If you have medical questions, please call us. God bless you. Thank you for listening. Have a great day, weekend, and talk to you soon. Thank you so much. This is Dr. Lederman. Have a great day.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212